Hi everyone, welcome to the Early Talker. If this is the first time you're joining us, welcome. This is the place where you can get tips and activities, how to get your little ones talking. Have you tried speech therapy and your child is just getting so frustrated? Well, today I want to share with you 5 tips on how to navigate these frustrations. Stay tuned. Today, I'd like to talk about some strategies that you can use to help reduce frustration in your little ones when you're teaching them language in these structured activities. And today's topic actually comes from one of my subscribers, so thank you so much for the topic suggestion. As always, I love to hear any sort of feedback or ideas for topics you'd like me to cover, so leave them in the comments below. Frustration and pushback from your kids when you're starting therapy is perfectly normal. If you think about it, one day your child has been having all of their needs met by just pointing, or you're anticipating their needs, and the next day you're really upping the ante and you're asking them to do something that they're just not used to. So change can be difficult, and it can be especially hard for some kids, so that frustration is normal. I want you to keep in mind these 5 tips to help you navigate this frustration and deal with your children while you're trying to do therapy. So the first strategy that you should keep in mind is try to have just one goal. Don't take on too much at a time. It can be really tempting to say, okay, we're starting therapy. I want my child to learn how to talk more. I want them to say this and this and this word. 3 different goals for our activity, and you have everything nicely planned out. It can be overwhelming. You want to start with just one goal in mind. Start with a word. Maybe you pick the word more, and you can do it in different contexts, in different activities, but just stick to that one goal, because it can be very difficult for children to just change their mindset all of a sudden. As I said before, they're having their needs met one day, and then the next day you're asking something different of them that they're just not used to. Once they pick up on the idea that you're trying to teach them something, then the ball starts rolling and you can start adding more and more goals. But at first, just resist that urge to take on too many things at once and pick one goal to work on. Tip number 2 is to make sure that you're modeling a lot. Think about it. When we learn something new, let's say a new language, we need to hear the words over and over and over again until we can really remember them and use them and say them. So in this situation, you're not only teaching them that new goal. So let's say the word more again. So you're not just teaching them that word more, you're also showing them that you're trying to teach them to copy you and to do what it is that you're doing. And that can be challenging for them. They might not understand right away that by you withholding the snack, for example, or you withholding that ball, in order for them to get what they want, they have to say the word that you're modeling. So you need to make sure that you're showing them over and over again what exactly you want them to do. And by modeling, that's a great way of doing it. You're not upping the ante yet. You're still just modeling for them more. You want more snack and opening it, giving them the snack, opening the box, or giving them the snack from the plate. And you're going to model that behavior many, many times before you actually ask it from them. So at first, you'll model it, let's say 4 or 5 times before you actually want them to say that word, before you withhold a little bit and say the word. The next important thing, so this is step number 3, is to make sure that you're consistent. So if you're not modeling consistently what it is that you're asking from them to repeat, they're not going to know, they're not going to have that specific instruction on what to copy. So if you say, again, we're using snack, for example, if you say, you want more? Should we open the box? Do you want some? These are all different signals that you're sending. We don't know which word you want them to repeat. So you have to stick to that one word. It sounds repetitious, but it is for a reason. You want them to know exactly what it is that you'd like them to copy. You say the word, model it over and over again, consistently with the same word, and then you give them what it is that they're asking for, so that they have that consistency of knowing that they say this word and then this action happens. Of course, if your child gets really frustrated and they're just hungry and they want their snack, or they're just frustrated with the game, at that point, discontinue and try it later. The goal is not to make them so frustrated that they just want to give up, because they'll resist playing with you and they'll resist that specific activity, because they'll learn that, oh, when it's snack time, mom or dad always does this game with me and I just don't like it. So you revert back to modeling a lot. Don't stop the modeling, but you stop upping the ante for them. You stop requiring them to try that word or try that the pair of words that you have together for them to actually get the outcome, get the snack, get the ball, whatever it is that you wanted from them. So you can discontinue and just try again later. Maybe try after their nap time, or try a little bit later on another day. Tip number 4 is to keep activities short. You don't want them to get overly frustrated, and you want to keep play or snack time fun. So if you spend, let's say, 3 or 4 minutes or 5 or 6 minutes, you know your child best how long their attention span is, then you get to take a little bit of time to actually do the therapy and work on your goals, but then you're not taking the fun out of the activity. They know that there is a set amount of time that they're going to be doing this, and then mom or dad will stop doing it with me and I'll be able to play my game, or I'll be able to finish my snack. So they're not going to get overly frustrated and then eventually avoid the activity, which is what you don't want to do. You want to listen to your child, read your child, and as I said before, if they get really frustrated, take a step back, maybe just model some more and revisit the activity for a later date. You want to keep in mind that nobody wants to be corrected all the time. It can not only be frustrating, but it can really affect your child's self-esteem. They might feel that they're not doing something right because mom or dad is always correcting me, and you really don't want that. So as I said before, stick to the 3 or 4 minutes or 5 or 6 minutes. You know your child best, whatever's good for your child, and then stop requesting from them, continue to model, but then activity's over. You're all done with the therapy and you just continue playing, or you continue having snack time with the good model. Tip number 5, and I would say probably the most important one, is to have patience. Change takes time. You're doing your best. This is new for your child. Have faith that being consistent, repeating over and over again, being a great model, and being patient are the most essential parts of seeing that change over time. Stick to it. Have patience. You got this. Thank you so much for joining me. I hope you found this video to be helpful. As always, leave comments below about anything that you'd like me to talk about, feedback on my videos, or topics you'd like me to cover. I'd love to hear from you. Until next time.